everyone, and welcome to the Greenleaf Dispensary show. I am Omar Picante, president of Greenleaf Dispensary, and I want to welcome each and every one of you to this month's show where we feature and talk with one of our recommending doctors. And today we're especially thrilled to talk with Dr. Julie Johnson of Louisiana Medical Marijuana Doctors. So, Dr. Johnson, welcome to the show.
Well, thank you for having me, Omar.
Yeah, before we get started, I just want to remind our viewing audience that before you can purchase medical marijuana at Greenleaf Dispensary, you must have a recommendation from a licensed doctor. And Dr. Julie Johnson here today is one of our licensed doctor partners, and she's excellent at doing so. So, Dr. Johnson, tell us a little bit about yourself and how you got started in recommending medical cannabis to patients.
Sure. Well, I'm a retired emergency room physician. I spent 30 years practicing emergency medicine. And about 3 years ago, I decided it was time to somewhat retire. But as most people know who are on my boat, you never really quite retire. So I wanted to do something to continue in the healthcare field. And my daughter actually talked me into medical cannabis. Now, she uses it for her health ailments. And she said, Mom, you really need to look into this more. And I think being an osteopathic physician, I went to school at Michigan State University, College of Osteopathic Medicine, and we were always taught from the get-go to have a more holistic approach, to take the patient as a whole. So I think that helps a bit also. But my daughter got me interested in it. I started researching it more. I wasn't naive to cannabis. And so I started getting more and more educated on it, the different strains, the different products, what it's beneficial for. And that's kind of how that took off. And that was about 3 or 4 years ago. And I've been going strong since. I keep telling myself I'm going to really retire, but I just haven't happened yet. I enjoy what I do. I really enjoy helping people. I just think cannabis is such a nice alternative to what we have out there.
Sure.
Compared to some of the other pharmaceutical agents. And I've been prescribing pharmaceutical agents for many years, but this is a real nice alternative to what we have.
Yeah, absolutely. Right now, I'm going to, a lot of times we get questions from patients at the dispensary that's kind of outside our scope. It's more doctor related. So what I want to do is just share some of those questions and get a perspective from an actual physician. So one of the common questions we get are the range of diagnoses that doctors see on a week-to-week basis. So what are kind of the different diagnoses of the patient presents with on a week-to-week basis where medical cannabis can be beneficial to the medical condition?
Gotcha. And that is actually quite a lengthy list. Range-wise, age-wise, I have patients as young as 5 and as old as I think 102 is my oldest patient. But so it runs the gamut age-wise. It's of course it's not for everyone, but there's many different conditions that is beneficial for. The younger patient is typically the autistic patient that it helps. But every day I see patients with chronic pain issues that have tried to get off opiates or are still on opiates, but the opiates aren't working well and they would like to try to get off their opiates. So chronic pain is an issue. Arthritis, very helpful for the inflammation you get with arthritis. Anxiety, very, very beneficial for anxiety along with insomnia. And I don't think as a medical society, we pay as much attention to anxiety and insomnia. I don't think it's researched well, and I don't think it can be quite debilitating. And I don't think as a medical community, we put enough emphasis on how it can be so debilitating, and we don't research it well. And it's so easy to give patients a benzodiazepine and then short term, and then all of a sudden 2 years later, they're hooked on it and then trying to get off it. That's a slippery slope. But we see a lot of folks with cancer that are going through chemotherapy. The chemotherapy has significant side effects of nausea and joint pain. The cannabis is very effective for that. PTSD is another one. A lot of veteran patients and non-veteran patients with PTSD really benefit from cannabis. So besides the pain issues, arthritis issues, the nausea from chemotherapy, the PTSD, anxiety, insomnia, those are some of the top ones we see regularly.
What you would say would be kind of as a follow-up to that question, kind of the difference with treating patients with medical cannabis as compared to a lot of your traditional pharmaceutical drugs?
Not significantly different, other than ultimately the choice is up for medical marijuana, the choice is between the patient and the physician. Of course, you've got to go through the different factors to consider with each diagnosis, what they've been on, what they haven't been on. But it's up to the physician and the patient themselves. And you get a lot of very educated patients who have been reading up on it and say, have been using cannabis for years and are finally saying, I've been using this because it's been working for me, and now I'm going to make it legal. So I hear that frequently.
Yeah. Let me ask this, as it relates to a comparison with cannabis and opioids for chronic pain and other condition, how is cannabis is a better alternative for the opioids that are recommended or prescribed on a day-to-day?
Much less side effects. Much less side effects. Of course, there's still some tolerance issues with cannabis that are easier to treat than the tolerance issues with opiates. But for long-term use, cannabis is significantly superior for long-term opioid use. It doesn't affect the liver. It doesn't affect the kidneys like the opiates do. It doesn't cause as much psychosocial problems as the opiates do. And as you may know, patients that are on opiates, it's tougher and tougher to get medication like that because of the crackdown stemming from the opioid crisis that came out a few years back.
Absolutely. What about for women who are diagnosed with fibromyalgia? Would you think cannabis is a good treatment option?
Actually, there's a study that has been done with opiates and fibromyalgia, and they have found that patients with fibromyalgia do have poorer outcomes with opiates versus cannabis. And as you many know, fibromyalgia is a very common syndrome, very common chronic pain, typically accompanied with sleep disturbances, sometimes cognitive impairment, psychological and somatic impairment. It affects about 2 to 8% of the population.
Wow.
It can be very debilitating. Studies again have found that the opiates with fibromyalgia have a poorer outcome versus cannabis. So very effective. Fibromyalgia or cannabis is very effective for fibromyalgia with significantly less side effects than traditional medication.
Let me ask you, for children who are diagnosed with seizure or experience epilepsy, well, as far as mature practice, do you recommend medical cannabis, or is it good as a good treatment option?
I do. I think it's still important to go through the whole gamut of testing. The FDA has actually approved, and they have an approved cannabis medication now for the two severe forms, the Dravet syndrome and Lennox-Gastaut syndrome. But I know patients have been using cannabis, and neurologists have been using cannabis when there is multi-drug resistance. And typically those two severe forms of epilepsy are usually multi-drug resistant, but there are other epilepsies that don't fit into that category that are also multi-drug resistant and also have significant side effects. So more importantly, we still need to do more research in that, but they are finding that the CBD portion, high concentration of CBD or high ratio of CBD to the THC. So the CBD is actually the effective portion of the cannabis plant that is helping multi-drug resistant seizures.
Yes. So let me ask, as far as we do get recommendation from Louisiana medical marijuana doctors. How has your experience been as far as our working relationship with Greenleaf?
Well, I think that's wonderful. I really enjoy working with Louisiana medical marijuana doctors. It's the owner is a local New Orleanian. I'm not sure if I said it right. And he's on the Better Business Bureau. And it's not a big box company where we actually get to spend time with patients and really get to listen to patients. And I know your pharmacy has done the same. When you call the pharmacy, you get to talk to a person every time. You have after hours, after on call, after hours. So if you have questions after the scheduled, either after a scheduled visit or after closing hours, you can actually talk to somebody. And that's pretty rare these days to actually talk to a person on the phone. So when patients have concerns or questions, and if they don't call me and they call you, and you've always have a pharmacist to chat with. So that is just a wonderful relationship.
Yeah, absolutely. And that's one of the things we pride ourselves on, as being accessible at all times, because things pop up after closing hours. So we wanted to make sure the pharmacist is always on call to address anything, any product related, any questions related to medications or what's going on. So patients have all responded well to that, and I think that's one of the things that set us apart.
Very
On
much so.
as far
Very
as
much
being
so, because this day and age, it's really difficult to actually get a person to talk to on the phone. As-
Absolutely, because I know from my experience of just calling different places, when you got to talk to and go through so many segments of questions and robotic communication, you just want to talk to a person because the computer or the phone system can't answer all your calls based upon what you need. So that's one of the things that I started from my own experience as being a customer to at other places that I wanted to have someone always available. So my personal preference, it seems to be a preference of a lot of our patients and customers.
And I agree. And I think that's what we try to do at Louisiana Medical Marijuana Doctors. It's about customer service. They're still customers and they're still your patients, but they're also your customers. And you want to make sure they have a pleasant experience and that they have their questions answered, because it's all about education and being educated in this.
Let me ask this: how can patients reach you, Dr. Johnson?
Sure. We actually have a website. It's Louisiana Medical Marijuana Doctors. Our phone number also is 504-442-9634. So you can get us right online, or you can call us right at the office right in New Orleans.
Absolutely. Lastly, Dr. Johnson, what would you? I'd like to give you an opportunity to give any closing remarks to our viewing audience here today.
Well, I really enjoy our relationship. Like I said, I'm very thrilled that you guys have, besides 9 to 5, Monday through Friday, you have Saturday hours, and many folks that do work a 9 to 5 can't get in, and not many of the other dispensaries have Saturday hours, and it's just really important for patient care. So I am really thrilled that you are in Homa and doing a great job down there, and I hope you keep up the good work. And
Absolutely.
hopefully we will continue having a nice collaborative effort in getting patients in Louisiana taken care of.
Yeah, we definitely will. In closing, I want to thank each and every one of you here today for joining us on this month's show, where we feature and talk to one of our recommending doctor partners. I just want to remind everybody before the first step in order to purchase medical cannabis, you must have a recommendation from a licensed physician. Dr. Julie Johnson with Louisiana Medical Marijuana Doctors is a highly qualified, highly sought after, and I highly recommend that you give a call. Thank you, Dr. Johnson, and thank you to our viewing audience for joining us here today. Take care.
Thank you all. Bye-bye now.
Bye bye.